right. Good afternoon. Welcome to another BioTalk. We started this topic exactly a week ago, on the 30th of November. So we're continuing today, and hopefully we'll be able to round it up. So we're talking about inflammation, and last week we were able to look at what acute inflammation is, and we did some introductory talk about chronic inflammation. So today we'll just focus on chronic inflammation, because that's actually the most the commonly experienced form of inflammation that we have around the world. So our focus is on chronic inflammation. So now, as we've mentioned last week, chronic inflammation is a long-term inflammation after it has passed through the stage of subacute stage. Some are as a result of acute inflammation, and some are just start as chronic. And also, we mentioned the fact that it's actually the most significant cause of death in the world, according to WHO. And the information here, I added in the information, and I was talking about chronic inflammation not being a specific disease, but a process. They're not really. It's not really like. They're not really like infectious diseases that you just believe that, oh, this is caused by this. Inflammation is a process, and a lot of factors are put in place. A lot of factors contribute to inflammation. So it is actually a process and not actually like a disease. So at any point in time, the process could be halted, so that the progression to the final stages can be stopped and it can be controlled effectively. So, okay. So let's quickly deal with this epidemiology. Epidemiology. This is just an outlook of the type of chronic inflammation, diseases that are due to chronic inflammation that we have, and the percentages of people that are infected, the numbers of people that are infected around the world, particularly the USA, that keeps a lot of record. Here in Nigeria, we do not actually have that kind of record keeping, but of course, it's the fact that it's happening somewhere else doesn't mean it's not happening here. So, as you can see that we have diabetes affecting millions of people, cardiovascular diseases, arthritis and joint diseases, allergies, and chronic obstructive pulmonary disease. And we have others as well. We have stroke, we have heart disorder, cancer, and obesity. All these diseases mentioned are due to chronic inflammation. And as we go on, we're going to get more information about them. So, what are the causes of chronic inflammation? We've mentioned all this last week, so we're just kind of doing a review here. We said it can be due to the failure of the immune system to eliminate infectious organisms. For instance, mycobacterial tuberculosis, which is tuberculosis is actually an inflammatory, a prolonged disease that's due to inflammation. So when a particular organism infects and it doesn't get cleared from the body on time, it can lead to chronic inflammation by starting from an acute inflammation. Then we have exposure to low-level irritants, foreign materials. We have also autoimmune disorder, when the immune system attacks the body itself in the form of immunopathology, autoimmunopathology. So we also have a defect in the cell that control inflammation It's also a cause, an important cause. This is mostly genetic in nature anyway. So when the cells that are supposed to regulate inflammation are defective, then you can understand that it will proceed at an harmful manner. Then we have acute inflammation also being recurring. If it's repeatedly being experienced, then it can lead to chronic inflammation. Then we now have other forms. These ones are caused by oxidative stress and other form of free radicals in the body and the likes. So this just to recap what we mentioned last week. So let's go to complications of chronic inflammation. Now, when we are talking of complications of chronic inflammations, we are talking of the end results. We're talking of the end results, and all forms of these diseases, they are as a result of chronic inflammation. So the chronic inflammation proceed like gradually, and it's a major contributor to many of these diseases. Of course, we have cardiovascular diseases, and there are so many strong relationship between markers of inflammation and cardiovascular disease prediction. Most of the issues that happen to organs such as heart, or maybe the clogging of the blood vessels, most of them are as a result of inflammation. We also have cancer. Of course, cancer, low-level inflammation also appear to participate in many types of cancer. Don't forget that cancer is the unrestricted growth of cells, or some particular cells. So some of these, if you remember, we said the mechanism of the cell controlling inflammation can fail in some way. So if the mechanisms of the cells that control, I won't call them the cells, let me just say the mechanisms that control the proliferation of cells also fail, it will lead to cancer, and then we have issues that can lead to chronic inflammations as well. So, of course, diabetes, we have issues of some particular immune cells like macrophages that penetrate some tissues, and in that process releasing what we call pro-inflammatory cytokines and the rest. So this also is as a complication of chronic inflammation. We have others as well. We have rheumatoid arthritis. Of course, arthritis is, for a long while, it has been associated with inflammation. It's one of those inflammatory diseases that are very common, especially at the joints, all over the body. You have frequent pain, and the reason is very simple. Most of these cells, most of these immune cells are not supposed to get into joints, into some particular places within the bone structures. Or when they get there, they releases cytokines. They releases. I keep mentioning these cytokines. Cytokines are inflammatory chemicals. They are pro-inflammatory chemicals. They are the chemicals in the body that induces inflammation. So that's why that's what we keep coming up. We mentioned those that particular word last week, cytokines, where I was talking about COVID-19 and how cytokine storm is one of the pathological effects. So we also have allergic asthma. Of course, asthma is a common disorder. I don't want to call it disease. It's a common disorder, and it's also inflammatory in some certain aspects, because by the time you have inflammation obstructing the airways, where the individual is supposed to breathe easy, then you have inflammation obstructing that particular place, then you have issues. Because don't forget that inflammation is just simply, it's simply the mobilization of immune cells to a particular place where a foreign or defective object that the body deems harmful is located. So if a foreign object, let's say an organism or whatever it is, or even smoking, the smoke from a cigarette gets into the airway, and the immune cells decide to congregate there to fight off that particular harmful substance, then you have all those immune cells blocking the airway, and this will lead to asthma. It's as simple as that, actually. Then we now have another ones that deal with the lung disease. That's obstructive, chronic obstructive pulmonary disease, COPD. So this one also, it's as a result of irritants within the airways. So okay, we have Alzheimer's disease, which is a disease of old age in some people, which is also linked to inflammation, and this leads to what we call memory loss and dementia and the likes of those. We have chronic kidney disease as well, and we have IBD, inflammatory bowel disease, which is also a very common chronic disorder. I think maybe in the nearest future I need to do some stuff on IBD, because I have a lot of friends who have this disorder, so that I'll be able to look at the treatment and how to address it in Nigeria. Well, keep that in mind, please. So what are the risk factors associated with chronic inflammation? What are when we talk of risk factors, we are talking of factors that makes somebody susceptible to a particular disease, factor that make somebody prone to have a particular disease. So in this instance, what are the factors that will make some people easily have chronic inflammation, unlike others? And the first one there is age. Age is a big issue. Age is a big issue. Most people suffering from inflammation usually older adults. Well, not older adults, but of course, the more we increase in age, the more we are prone to having some chronic inflammatory responses in our body. And as written there, I've said it's majorly because of mitochondrial dysfunction, free radical accumulation, and visceral body fat. So, okay. All right. So the other factor is obesity, of course. Obesity is also a big risk factor associated with chronic inflammation, because we believe that the fat tissues are synthesizing inflammatory mediators, and because of that, of course, there's high tendencies of having chronic inflammation if you are obese. Another stuff is diet. Diet, of course, is a big factor. There are some particular classes of food, like fats and refined sugar, that are associated with a very high production of pro-inflammatory substances in the body. So, of course, we're going to discuss diets during the management and prevention of chronic inflammation. Smoking, smoking is a big factor as well, of course. Most of the inflammation that are recorded in the lungs are most of them are due to cigarette smoking. And now this is where it gets interesting, of course. Low sex hormone, okay. Low sex hormone has been shown to be an indicator of to be a risk factor in the process of chronic inflammation. So if you are not synthesizing the regular sex hormone at the appropriate amount, there's tendency of having chronic inflammation. And you can see that it's written here that it's been observed that maintaining sex hormones level reduces the risk of several inflammatory diseases. This is a topic I would like to discuss very much later. Okay, we'll talk about that. All right, so okay, another risk factor: stress and sleep disorder. Okay, I think this one is going to hit me hard because this is also a risk factor. If you're not sleeping well, if you're getting yourself stressed. Okay, we're going to talk more about this because I remember that when I was preparing this slide, we have this also stated under the what they call it, under the management and treatment and the prevention of chronic inflammation. So we'll definitely talk about sleep and stress disorder very much later. So let me adjust this. Okay, so what are the symptoms of chronic inflammation? These are the symptoms. If you are observing this, they are not definitive. They are not definitive symptoms anyway, but these are usually the signs that somebody might be having chronic inflammation. So you can see body pain, arthritis, myalgia, chronic fatigue, insomnia, inability to sleep, depression, anxiety, mood disorder, GIT complication, such as diarrhea and the rest, weight loss or gain, and frequent infection. These are the common signs and symptoms that develop during chronic inflammation. Like I said, they are not definitive. We still have all other diagnostic method of knowing. I hope I include it. I think I should include it's been diagnosed, if not. But let's just go on anyway. So, okay, now let's go to the treatment and the management of chronic inflammation. Now, if you're having or you have a relative that has all the diseases I've mentioned in the maybe second or third slide, diabetes, cardiovascular issue, and the likes. So I really want us to take this a little bit serious so that we know how to manage all these infections, not infections, all these diseases and disorders. So the first way of managing chronic infection is a lifestyle change. So yeah, you have to include some, of course, weight loss is recommended. Weight loss is recommended if you are having diabetes, having obesity, even heart diseases. Yeah, weight loss is always recommended because we believe that it's one of the risk factor. And if somebody can drop weight and you are measuring your BMI regularly, body mass index, you'll be able to. So for those who are on the big side, you have to take some experience of weight loss in order to. And another way, a way of doing that is actually exercise. Exercise are actually very, very, very important. If it's just walking, these are common stuff that most of us know about anyway. So exercise helps in lowering a lot of pro-inflammatory substances in the body. So light walk, little press up, jogging, just regular exercises, and it's actually assists in the management of chronic inflammation. But now the real management of it goes to our diet changes. You can see all this stuff written here. Low glycemic diets, okay? Now, when you are taking diets that are high in glycemic value, there is risk of stroke, type 2 diabetes, and coronary heart disease. So you can see the list of foods that okay, that's why I said it's going to get a little bit personal for some of us. You can see those foods that are being recommended that we drop. Sodas, refined carbohydrates, okay, refined carbohydrates, that includes sugar, refined sugar, and fructose corn syrup, and all those kind of food. Then we have to also reduce our intake of saturated fats, total saturated and trans fats. This is usually contained in processed and packaged foods such as seed and vegetable oil. Now, one of the issues, let me quickly state this before continuing. One of the issues we are always having when we're talking about dietary changes, people believe it is the complete absence of this food that we are always recommending. No, we are not recommending you to stop taking them. We are recommending you to reduce their intake. That is the word there, reduce, low. You can see that low glycemic. They didn't say you should not even take anything. They just say you should reduce it, you control your consumption of this food. So we are not boxing you into a corner, like say, oh, don't take it at all. No, we're not saying that. Just find a way to reduce it. And of course, definitely, fruit and vegetables are always recommended. They are very, very good when you want to manage chronic inflammation. They even listed it for you. Cherries, we have cherries in Nigeria. I don't know, blueberries, this food that we have to go to ShopRite to get. But apple, okay, we can get apple. Cabbages, I have, maybe I'll need to be getting across to my friend, Farmer Lawrence, to be supplying me all this. So all these things are high in natural antioxidants and anti-inflammatory compounds, and they protect against inflammation. So, you can see other recommended dietary substance, which include consumption of fibers, nuts, such as almond. I hope other nuts are recommended anyway. Okay, green and black tea. I don't know all this, but you can research it. Curcumins, that's a constance of turmeric. Oh, I know about fish oil definitely, but I think I did the research on it. They are high in omega-3 fatty acid, which is actually good for people suffering from cardiovascular diseases. Mung beans, then food rich in all these micronutrients, and sesame oil. Well, I think I heard somebody talking about that recently. So just find ways to incorporate all this management if you have a chronic inflammation, find ways of incorporating all these changes as it's being recommended. So I think the next, now the next is drugs that can be used in treating chronic inflammation, conventional drugs. So and these are the generic names. When you get to pharmacies, hospitals, or wherever you want to get all these drugs, you can state the generic name. Those are the people at the pharmacy. We eventually have to look for them. So we have non-steroidal anti-inflammatory drug, NSAIDs. Okay, these are actually very common. When you get there, just say you're looking for anti-inflammatory drugs, and they are going to get it for you. So you can see what is being said. Ibuprofen, aspirin, they act by inhibiting an enzyme that contributes to inflammation. So they help in doing that, and they are mostly used to alleviate the pain caused by inflammation in patients with arthritis. Definitely, of course. This drug are actually very good, but like I said, recommended cannabis for you, but of course, these drugs are good. These drugs are good. These herbal supplements are good in this, and like I said, however, you should always consult with a doctor before they are used, please. And please, caution should be taken when you are taking cannabis, please. So then we have drugs that are starting anti-inflammatory. They said they are anti-inflammatory drugs that, as they reduce multiple circulating and cellular mediator of inflammation. Then we have corticosteroids, which also prevent several mechanisms involving inflammation. Then we have metformin, which is used in the treatment of type 2 diabetes patients. So now, what are the preventive measures that you can take against chronic inflammation? Preventive measure. The first thing listed here is now this one is different from, it's also part of the management, but this time around, because of the tendency of those with the risk factor that we mentioned at the beginning of this talk, let's see if we can discuss the means of preventing it from happening. And the first thing listed here is you have to increase the uptake of anti-inflammatory food. So you can see what is being listed: avoid eating simple sugar, refined carbohydrates, high glycemic food. You reduce it to the barest minimum, and you need to consume whole grains, natural food, a lot of vegetables, a lot of fruits. I know that if my friend Adana Kudo is there, she would like this. Of course, she's always feeding us grass. Don't tell her, please, if you. But she's always feeding us. She's always a recommender of vegetables and fruit. So we can increase the uptake of this food to prevent chronic inflammation. And we have to minimize the intake of antibiotics. We can't even go into this topic today, but you need to actually do it. And you see what they said again, that NSAID, the non-steroidal anti-inflammatory drugs, they also need to be reduced. The usage must be controlled. Just don't pump antibiotics into your system and all these other drugs. This reason is stated here is that they could harm the microbiomes, the microbiota of the gut, and cause another issue entirely, cause inflammation in a different way entirely. Of course, you exercise regularly. We can't state that. I've been doing, I think this is what keeps my own chronic inflammation at bay. I do exercise regularly. And you can, all form of exercises are okay, as long as you believe that you are being faithful to it. So then, yes, you. Okay, these last 2 points are okay. They are my own personal. I think it's like me being self-critical this time around. You stress less. I'm trying to reduce this. As you can see, what is written: chronic psychological stress is linked to a greater risk for depression, heart disease, and body losing its ability to regulate inflammatory responses and normal defense. Yes, you need to find a way to reduce stress, and they recommend yoga. Where is my friend Olutayo? Yoga is actually good, so you have to find a way to reduce the stress. As you can see, what they said, when you are having a chronic psychological and even physiological stress, they can induce inflammatory mediators, inflammatory substances. And now they also punch me again by saying that you should sleep longer. Okay. I slept by, I think, around 1 a.m. This morning, and I woke up by 4, so I'm already breaking this rule. So they say you should sleep, overnight sleep, 7 to 8 hours, help stimulate human growth hormone and testosterone in the body to rebuild itself. It's helped even the immune system, it's helped the body to regenerate, it helps the body to calm down. So most of these most of these preventive measures are linked with the management. Even if you're already having it, you can still find a way to prevent it from further escalating to terrible levels. I think there's a particular part of this that is missing. I think I didn't put it. That's the diagnostic. The diagnoses are not here, but how you can easily. But most people who are suffering from chronic inflammation already have medical doctors that are helping them manage the disorder and disease. So the diagnosis is multifaceted. Let me quickly go to this. I think the second slide. I think it talks briefly about the diagnosis, so that we won't. Where is it? Okay, yeah. So this is part of. There's an information here that's at the last paragraph. They said a good history, physical examination, routine laboratory tests. Yes, for all this one, glucose, creatinine, liver function, serum protein electrophoresis, rheumatoid factor, complete blood count, anti-nuclear antibodies. This can either confirm or rule out whether you are having chronic inflammation or not. So when you go for diagnostic checkup, imaging study can also be used. So as you can see, yeah, I think a friend of mine underwent this particular colonoscopy recently. They were suspecting IBD, of course. So this actually more or less summarize what the diagnosis for chronic inflammation is. So, of course, you need good medical facilities for you to be able to get a good diagnosis, and all these tests, they are very, very important. So when you, at your private time, just go through them. You can even discuss them with your health care provider, and then, of course, hopefully we'll be able to manage all these chronic inflammation, arthritis that we are having. That is the end of this topic. I hope I'm able to just do some little, so I've done some justice to it. Thank you for listening. We've come to the end of inflammation. Of course, the questions will be answered at the comment sections, and if there are any other further clarification needed, you can definitely get across to me. And also, I just remember something again. There will be part of the topics that I mentioned that I will be talking about later, and then we'll be able to discuss them very, very well. Thank you so much. Have a lovely day ahead. Bye.